morning to everyone, and thank you very much to the conference organisers for inviting me to give this keynote presentation today. I have spent my career researching violence against women. I have mainly been working in South Africa, where I've been employed throughout my career, but I also do know the Asia and Pacific region quite well, because I was a senior technical advisor on the UN multi-country study on men and violence in Asia and the Pacific. And I led the What Works to Prevent Violence Against Women and Girls consortium, which worked across 17 projects in Africa and in parts of Asia. I do apologise, however, for having a very South African slant on my work, but I hope that with my background and grounding that you understand it's got a much more global relevance than the clear bias in the countries from which I present work. So I want to talk to you overall about really what it means to go forward with a deliberate agenda of wanting to make an impact on violence against women and girls, and how to think through it, and how the evidence that we have from the work that we've done over the last 3 decades enables us to build up an idea about basically a plan of action about how to have an evidence-based impact. And so the starting point needs to be really defining what we're talking about. And violence against women and girls is a very broad sub-area, and the largest part of it I've represented in this purple circle as being intimate partner violence. And intimate partner violence itself has many sub-forms, both physical, sexual, emotional, economic violence, as well as controlling behaviour. And I've highlighted the fact that intimate femicide, the most extreme consequence of intimate partner violence, the deliberate murder of women by an intimate partner, is very much both most extreme consequence and a form of intimate partner violence. It's one that globally has received much less attention than both it deserves, but also than other forms of intimate partner violence, because it is non-fatal violence that is by far the most common lived experience of women within intimate partnerships globally. Violence against women and girls doesn't only mean intimate partner violence, even though this is the most common form, and it obviously encompasses non-partner sexual violence, whether that is rape, other forms of sexual assault, sexual harassment, child sexual abuse, for example. It encompasses other forms of violence against women, trafficking for sex, child marriage, and harmful traditional practices that take many different forms in many different countries. And there are obviously many other forms of violence against women, but these are the most common, and indeed the ones for which people have conducted the most research. So if we're thinking about trying to address violence against women across a national context, the first thing we have to do is to really understand our challenge. There is now prevalence data on intimate partner violence conducted in at least one community-based household survey for almost every country in the world. And what I've done here is to summarise the prevalence of women's past year experience of physical or sexual violence at the hands of an intimate partner from a range of different countries, from Africa and from Asia. And I want to show you that this can vary very considerably between countries. The smallest figure we've got on the extreme right-hand side, as you see it, is South Africa. That's from our 2016 Demographic and Health Survey, showing about 1 in 10 women had reported this form of violence. As you can see in Ghana, it's about double that. Nepal, higher still. And as we go through these countries with a much higher prevalence of violence, what you can see are countries that have a conflict or are recently post-conflict. And these countries tend to have a higher prevalence of violence. But as you can see, as the prevalence of violence increases, we come to the extreme left-hand side of this figure, and you see another prevalence for South Africa. And this figure comes from household-based research in an informal settlement within South Africa. And it's very similar to the figure that we have from research conducted in multiple informal settlements in South Africa. In this graph, I want to show you two things. Firstly, there is a very substantial difference in the national prevalence rate that we see from surveys in different countries. And secondly, that the prevalence difference between different parts of one country can be even bigger than the difference you see between countries. And what this tells us is that it is absolutely essential to know your landscape of violence when you're thinking about preparing to prevent violence, because you need to understand where the high-risk communities are. It's not a coincidence that these were informal settlements in South Africa, because we know of a very strong link between poverty and experience of all forms of violence. And so this is something that can be entirely predicted in any global setting. So this takes me to my second point, which is that if you want to develop a prevention and response of violence against women, you need to understand what's driving it. And this slide shows a figure that is published in the paper on New Directions and Understanding Drivers of Violence by Andy Gibbs and colleagues. And what it shows us is that if you want to understand the drivers of, here it's called gender-based violence, and that's because, but it is predominantly intimate partner violence. We need to understand that that we have structural drivers and we have individual and relationship level factors. The most important structural driver, of course, is gender inequality, patriarchal privilege, and the disempowerment of women. And very closely linked to that is the normative use of violence in multiple aspects of social relations. Both of these structural factors are driven by poverty, low levels of education, low ability of women to exercise power, both at a community and at a societal level, which are obviously linked to poverty and low levels of education and all of the other entailing factors. If we look at the impact of poverty on men, we see that men who are food insecure are 50% more likely to perpetrate intimate partner violence than those who aren't. And that highlights this increased risk associated with poverty. Drivers of gender-based violence are not only found at a structural level, it's also very much influenced by individual level factors, poor communication and relationship conflict responses. This is very often interconnected in multiple ways with poor mental health and with substance abuse. And we must never underestimate the impact of substance abuse on gender-based violence. men who are heavy drinkers are 2.5 times more likely to perpetrate intimate partner violence than those who don't drink. And in settings where drinking is less common, drug use is also associated with similar levels of elevated risk. And obviously, poor mental health and substance abuse is very closely interconnected with the experience of both witnessing violence against your mother in childhood as well as childhood trauma of other forms. And we know that men who have witnessed violence against their mothers in childhood and experienced childhood trauma across Asia and Pacific, 2.5 times more likely to perpetrate intimate partner violence. So these drivers, as you can see, individually are associated with elevated risk, and in combination, you see an exponential rise in risk, all of which is fueled by conflict within societies or by living in the post-conflict setting with a heightened exposure to violence and the enduring guns and violence around, as well as the very widely prevalent mental health impacts of living within conflict. Sorry. So how do we mobilise knowledge of prevalence and most at-risk groups and drivers into planning prevention programming? Well, I want to argue that knowledge of local circumstances at a national and community level is absolutely critical for setting local goals, for taking the global knowledge and bringing it down into concrete programming at a local level. Program design needs to be from the bottom up, based on what's feasible and achievable in any local level. So let's consider the starting point. In order to give you a starting point, I've developed a model of the change cycle based on Prochaska and De Clementi's stages of change model. And I want to argue that understanding the setting is absolutely vital when thinking about planning and intervening on violence against women and girls. It's essential that you understand norms, laws, policies, and overall readiness to change. In most of our settings, our starting point is one, whether now or in our recent history, because we all live in a recent history where this was a starting point. Patriarchal norms are defended, the use of violence goes unchallenged, men's use of violence goes unchallenged, and violence against women and girls is hidden and stigmatized. Now, there are many countries in the world that have not moved beyond that starting point. And it's absolutely essential to understand where a country is. Because if that's where you are at the moment, then your goal needs to be to move to the next stage, to the stage here of early awakening. And if you're already at the next stage, then you need to look to see if you can move to the one afterwards. So and understanding this as a circle, it's actually a revolving spiral of change. It's important that we take our steps one at a time, because if we don't do that, then we're not going to be trying to construct a task that's feasible. So in a setting where that's highly patriarchal, norms are highly defended and violence is stigmatized and hidden, what you need to do first is to bring about an early awakening, break the silence surrounding violence against women through activism, through use of the media, challenge men's entitlement to use violence against women in these ways, and provide survivor support. And this is normally started through NGO sector shelters and counselling for survivors. It's absolutely critical. We cannot talk about preventing violence against women and girls if we do not recognise the lived experience of survivors of violence, and we don't stand up and say we have to do something to help women who are experiencing violence. In every setting, this isn't going to be a shelter. The cost of going into a shelter for an individual woman, if you live somewhere like Afghanistan, is enormous. So it's not going to be a lot of women for whom that is going to be what they need and want to be able to do. But it is important that shelters are available for women who need them. Counselling is incredibly important for all survivors of violence. It's something that can be provided in different settings much more safely. And I'm not saying that any of this is necessarily inherently safely provided, and that safety needs to be built into the mechanisms and the plans for action. And it is only when you have begun to break the silence within a community, and when you can begin to see that there is change on the unshrouding of violence, people are able to speak up. It is possible to provide services, and there's more discussion around the use of services for supporting violence, that any setting will be able to move towards policy action. We know that you can jump this stage. We know that sometimes there's international global action to make countries jump straight to the policy stage. But I'll tell you one thing which is not very well recognised. We all know when we live in the global south, is that you can have a massive disjunction between a national policy and what's implemented on the ground. And a national policy has no value whatsoever if it doesn't translate into the behaviour of state actors on the ground. And if you jump this, you will achieve something that looks good on paper and enables a CEDAW report, but means nothing in terms of the lives of women. And it's absolutely essential that we make sure that there is a focus on breaking the silence around violence against women and girls and supporting survivors in order to be able to have meaningful impact in communities and begin to send a message that actually we're on the side of the survivor, that we care about survivors, and no, men who use violence are not right, they're wrong. It isn't a privilege that they can have and that they enjoy. So when we've broken, very often what you see in countries is that actually the early awakening is what's needed in order to get law changed. And laws changed because of lobbying within at a country level most effectively. And then with change in laws to outlaw different forms of violence against women, can come a review of the role of the state sector, policing around new laws, the role of the courts, the role of the health service, the role of schools, resources from state for survivor support. And when you have got fundamental law change and silence broken and survivor support, then you are positioned to actually make a difference through prevention programming across different sectors. You can extend counselling access, and obviously monitoring all of this is crucial. And I present this as a cycle because it's important to know and remember that backlash is very often a consequence of all this action, and that circles don't just turn into spirals in a positive sense. And so the backlash then needs to be addressed if it happens. But otherwise, this would be spiraling action that can result in real impact on the lives of women. So I want to show you a bit about what can be done through national laws and programs, because if you haven't got to be at this stage set up properly, then there isn't a lot of impact you can have at a national, across a country through work in prevention in communities. You need to get your national pieces in place. Domestic violence needs to be criminalised. Rape needs to be criminalised, particularly rape in marriage, which is the one form of rape which is so often not enshrined in the criminal code in countries. Child abuse needs to be criminalised, and we need protections for victims and survivors as part of the laws. Protection orders, divorce laws that enable women to leave marriage with their children and with division of property that enables them to live independently. Child maintenance and arrests for perpetrators. And then we need multi-sectoral action. If police are going to inform of laws, they have to be trained. You need to work on gender equality training for the police officers, or bringing in things like women police stations and so forth, and monitor law enforcement. The same for judicial officers in courts, and establish courts that will implement laws, provide protection orders with sentencing and that is effective, and training for judicial officers. In most of our countries, the government-funded education sector uses national curriculums. We need to look at the role of our national curriculum in education and in the way gender equality and violence are actually addressed, or non-addressed, patriarchal privilege addressed and built within our education sector, and turn that around. We need to look at the economic, social, political, educational empowerment of women. Policies related to alcohol sales and drug law enforcement, firearms regulations, and the role of health sector in treating injuries, in mental health and substance abuse treatment, and so forth. So to give you an idea of what can be achieved through national policies, I want to show you here some new data that's emerging on the impact of protection orders in South Africa on violence against women. And it's very much a subject of debate in our media. People report from time to time about women being killed at the hands of their husbands in South Africa, or their partners, when they have a protection order against him. We know that happens, but what we haven't been able to see before is what is the big picture in terms of the protection women get from protection orders. And this slide I've got here is based on data from about 2,000 women who have protection orders in South Africa. And in fact, what we see here is that over the years after a protection order, 15% of women said that the violence had stopped, but 52% said it had reduced. And in fact, there's a little group here who say that 3% who said it actually got worse, but then it improved. In total, this is 72.4, nearly 73% of women. So 3/4 of women saying that they do benefit from a protection order in terms of a reduction or stopping of violence. And in fact, the benefit is much greater if women leave perpetrators. And one thing that is often not remembered is that in a country where our most impoverished communities are most affected by violence, most women, even women seeking protection orders after experiencing severe violence, cannot leave the man who's violated them. And this obviously undermines the impact of the legal instrument. But I think it's really important that you still see an impact for most women, even though the ideal setting for impact is not available. I want to show you what firearms control can do. In South Africa, guns have been a major part of the story of the murder of women over the last 3 decades. These graphs are based on our national surveillance of femicide in South Africa. IPF here is intimate partner femicide, women killed by a husband or boyfriend. And all femicides includes women killed by any person. It's almost all men. Women don't kill women very often. So what we see here is that in 1999, that's the green bar, a third of our femicides were caused by firearms. And by 1909, the purple bar, you see it's dropped to under 20%. And it's just a little bit higher in 2017, that's the orange bar. What made it drop? It was firearms control. We brought in very vigorous firearms control in 2004, and this was then well implemented and had a big impact on femicide. Unfortunately, we have the blue column, which is our most recent estimate on the use of firearms in the murder of women in South Africa, and we see now that the proportion of murders with firearms is even higher than it was in 1999. Why do we see this? It's called corruption. It's undermining our firearms control directives, which are all still in place, but corruption has seen this massive increase. But it shows what can be achieved when you look at the earlier figures. Alcohol. What I've got here, this is looking at femicide. We studied femicide during COVID lockdown, and I know we all come from different countries, so we had different experiences of COVID. But in South Africa, when COVID lockdown started, we had no alcohol sales, and we were all confined to our homes for almost the entire day. And this lasted about 5 weeks. And then gradually, the next phase came in, where we were still not allowed alcohol, and but we could go out during the day. We just had to be in at night. And then we got our alcohol sales back a few hours during the day. We had to be locked up at night. And then the curfew got more relaxed until it was very late night that our curfew came in, and we had limited alcohol sales, and then all the restrictions were removed. And what we see is that if you look at the orange bars, which are the intimate partner femicide cases, this gradual increase in femicide, more than doubling from the stay-at-home, no alcohol sale period until we got into the period of no restrictions. And when we looked at this, we saw that the biggest jumps were occurring in relation to unlocking of the alcohol sales. So I'm not saying that every country is going to move towards banning alcohol sales unless they already do that, but I want to say that we need to really understand the role of alcohol and the benefit that can come from restricting alcohol access and reducing access, particularly for very heavy drinkers and to very high alcohol percentage volume drinks. So that shows you things that can be accomplished at a state level. And one of the most important things at a state level is you can have mass impact, and even a small impact on percentage of IPV, intimate partner violence, violence against women exposure across a state, can result in a huge number of women being not any longer exposed to violence within their lives. And so state level intervention is incredibly important. But we also need to work at an individual, couple and community level. And there have been about 25 years, nearly 30 years of research in different settings, developing and testing interventions that can either reduce women's exposure to violence, men's perpetration, or both. And this year we conducted a systematic review of all of studies evaluating violence prevention interventions that had intimate partner violence or rape and sexual assault as an outcome. Published before the 1st of January this year. They had to be quantitative and they had to have a control arm. We found in total there were 184 published studies of that is interventions arms with a control arm. The number of papers is a bit less. Number of papers have more than one intervention arm. And we looked at the quality of the research conducted and the outcome reported. And this systematic review I conducted with my colleagues Andy Gibbs, Leanne Ramsumar, Pinky McCrangle and Esnat Chua. What we showed is that there is a massive imbalance in the global literature. For those of us who come from South Africa, that's great because half the literature's from sub-Saharan Africa, so it's very directly relevant to us. Much less good news for people from Central and Southeast Asia, where although you have a very substantial proportion of the world's population, only 15% of the literature on what works to prevent violence comes from this region. And even worse news if you're in East Asia or the Pacific, Latin America, and so forth. Taking into account this imbalance, or acknowledging it, because we can't really take it into account further, we now find that in many other ways the global literature is becoming more and more diverse. So there are a large range of different participant groups that are being enrolled in these interventions. Almost all of the interventions include adult or adolescent women. Over a third have adolescents in them. And we see here that if we look at men or adolescent boys, it's over a third of interventions. Now, that's not good news, is it? Because it's men and boys who perpetrate violence against women and girls. I can ask you how we are going to prevent violence against women and girls writ large if we don't include men and boys in our interventions. It's not going to happen. There are a subgroup of interventions that are bringing in couples, and I'll show you that there is a growing interest in that as a group. Some interventions are being implemented within health sector settings, very often obstetric settings and HIV clinics. We see about 1 in 20 of our global interventions are being tested in conflict and humanitarian settings, which doesn't fit at all with need within those contexts. And a similar proportion amongst people living in informal settlements, even though the world's informal settlements, slums, favelas, whatever you call them, are the site of some of the highest prevalence of intimate partner violence, violence against women that we see anywhere. Female sex workers are a particularly at-risk group and have been subject to a small amount of work in this area. There are some interventions focused on parents and some interventions focused on perpetrators who are mandated by court to enter the intervention. These interventions are now using a very wide range of methods. Most common amongst them is the use of participatory group interventions. You may have heard of stepping stones because it's the most widespread such intervention. I think it's been used in over 100 different countries, been translated into over 40 languages. And that is an example of a participatory group intervention. People are brought together in groups. In stepping stones, you work in single-sex groups, and use participatory learning methods, particularly drawing on critical reflection. There's very much an emphasis in the Stepping Stones context on skills building as part of that, communication and relationship skills, seen as fundamental to both HIV prevention, for which it was initially developed, and violence against women prevention. There are a number of economic interventions that have been trialled over the last 20 years. Cash and asset transfers make up nearly 1 in 5 of these. And if you look higher up in this list, you'll see savings, vocational training or livelihood training, similar prevalence, microfinance and other loans. That's much less commonly done, mainly because you need a microfinance platform to do it. And those are fewer and more far between, and generally not set up for this intervention. The interventions are using community mobilization approaches. We see the use of individual and group-based psychotherapy and counseling in some of them. Some of them are using sort of influencers in a way, either healthcare and social worker delivered, or increasingly we're seeing exploring the use of faith leaders as influencers. Web-based methodologies are more modern approach, but still under 10% of the interventions use them. Safety planning is included in some of these and is the main platform for prevention, some of them, and life skills training. And I think if you think back to my second slide on risk factors, it's really important to look at which risk factors people are trying to change, because interventions have to change risk factors. The funny thing is, when we did the systematic review, there are a set of interventions that are not developed to address any known risk factor of violence. That's a bit sad, because they're not going to work, but they must do. So about less than half of the interventions trying to address norms on gender and violence. Norms on gender and violence are the most important structural driver of intimate partner violence and violence against women. So it's a bit, one worries when one sees that less than half are trying to do this. Women's disempowerment, which isn't always addressed in an intervention trying to address norms. I think you can begin to see that we have some weaknesses in our interventions. Poverty is being addressed in a third of interventions, that's the economic ones. Poor conflict and relationship skills in nearly a third. Mental health and sort of cognitive restructuring in 15%. Harmful alcohol drinking and illicit drug use in 10%. And I should say, obviously, some interventions address more than one. That's why the percentages don't add up to 100. So having looked at which risk factors interventions address and realizing that there are some mismatches between what we need to do and what interventions actually are doing, it shouldn't surprise you that actually most of our interventions aimed at preventing violence against women and girls don't do it. In fact, there's only evidence for a third of them. So 2 out of 3 interventions that people have put to the test to reduce violence against women and girls have not been effective. And that's an incredibly important finding, because that means we have no room for complacency. If you want to do a job, you have to do it properly. And these interventions need to be developed and implemented rigorously, or we're not going to achieve what we set out to achieve. And if our work doesn't do the task we want it to do, then we haven't accomplished our goal. The big question is, what seemed to make a difference? We looked at whether the impact didn't impact violence against women and girls by the participant groups involved. One thing that's clear is you're much, much more likely to be in the column here for reducing violence against women and girls if you have men and boys in the intervention. That is a really important finding. And ditto for couples. These are much more likely to be effective, but whether that is because it's a couple or whether it's because men are involved, one doesn't actually know from this analysis. I'm skirting over the groups where there's very little difference, but I will show that the direction of effect for adolescents is in the wrong direction. Most interventions with adolescents are more likely not to work than other interventions, and that means that we're not doing the right things. Conflict and humanitarian setting interventions are very unlikely to work, and that means we're definitely not doing the right things or not implementing in the right way. We need to go back to the drawing board there. And the prevalence of work with these different participant groups, these others, is fairly small, but there's some promise around informal settlements. What about the methods used? Do some methods show more promise? There's a bit of an effect in this slide for in favour of manualised group interventions. It's not looking good for cash or asset transfers. And if we look down the list at all of the other forms of economic intervention, we're seeing that there are distinct worrying trends. There could be some promise around the use of faith leaders, but otherwise there's not a great deal here. Psychotherapy, individual-based psychotherapy, doesn't look very good. What about using multiple methods? Well, we actually, our field has generally said that you need to use multiple methods, but in fact, the evidence at the moment is not showing promise in the direction of multiple methods. The main reason why this is that most interventions to prevent violence are actually developed and implemented by one group that normally has expertise in one method. And if you ask them to go and do multiple methods, they do other forms of delivery and implementation badly. And some of the worst examples are with some of the Dreams projects in Africa, where you've got half a dozen different types of methods being used and almost no implementation for many of those different types of methods. And that is not going to help anyone. So the message here is, when people plan to do something, they need to do it well. What about addressing multiple risk factors? This has a different conclusion. And in fact, the evidence is that if you address more risk factors, you get more benefit, with the largest benefit being studies designed to address 4 risk factors. So let's look at whether individual risk factors were important. And what we see is that there's a trend towards interventions being more successful where they address norms on gender and violence. And we see much greater success where poor conflict and relationship skills are addressed within interventions. There's very little one can say about other risk factors. We did an analysis looking at what were the factors associated with a greater or lesser likelihood of showing an intervention actually reduced violence. And overall, there were 2 significant positive factors. One being the inclusion of the goal of addressing poor conflict and relationship skills as a risk factor, and this is normally done through these participatory group interventions, although not every participatory intervention does this. But where it's done, you get 2.5 times greater likelihood of the intervention being effective. And we also showed that interventions that were well evaluated were much better at showing that the intervention worked. And I think that this is both because the power of the evaluation and its design is critical in showing impact, but also where you have a strong evaluation team, very often they worked with the intervention delivery team to make sure the intervention was more rigorous, was built through a sound theory of change, and therefore was much more likely to have impact. So, interventions that aim to build better conflict and relationship skills and are better designed overall were kind of 2.5 times more likely to be shown to work than other interventions. That was our overwhelming finding from the review. It's 184 studies is still a small evidence base, and particularly for doing a statistical analysis on what works, but I think the findings emerging are important. What they show us is that it's absolutely critical to pay attention to the elements of design and implementation that are necessary for more effective interventions. At the end of the What Works to Prevent Violence Against Women and Girls global programme, we conducted an analysis across our interventions and showed that these elements were associated with success. The ones marked with a star have to be part of every intervention, whereas the others are not always applicable. But every intervention has to be rigorously planned around a robust theory of change, rooted in knowledge of the local context. Needs to tackle multiple drivers of violence against women and girls, such as poverty, gender inequality, poor communication, relationship skills. Especially in high patriarchal set context, it's important to work with women and men, and in some countries in Asia, for example, to work with families. It's also essential to integrate survivor support into the intervention. Where relevant, interventions need to be based on theories of gender and social empowerment that view behaviour change as a collective rather than an individual process, and foster positive interpersonal relations and gender equality. Participatory learning methods for adults and children that emphasise empowerment and critical reflection, communication and conflict building, resolution skills are really important. And if you're working with children, age-appropriate design is important. And with manualised interventions, carefully developed manuals are essential. And when we implement, we need to get the duration and intensity of the intervention right. If you're using sessions, the number of sessions, the number of hours of the session, in order to realistically expect behaviour change. Interventions that are manualised that work tend to have about 30 hours of intervention. And it is essential that staff and volunteers delivering interventions walk the talk. That's critical. In highly patriarchal settings, it is a challenge finding people that actually embrace the norms that you want to propagate through your intervention. But you need to put that time and effort required into staff training, whether that's 1 week or whether that's 3 months, to make sure your staff are going to do the job you want them to do. Because if you give them a short training and send them out there and they don't actually embrace the ideals of non-violence and gender equality that you want to propagate, you can't implement your intervention. So it's incredibly important to select the right people, train the right people, support them. So overall, what I've shown is that interventions need to be locally grounded and address the most important risk factors for an area. Survivor support must be in place before other violence prevention is developed, and all aspects of violence against women prevention must be empowering for women, however that's expressed in a local setting. Working for stronger public policy is crucial and can be really impactful, reaching very large numbers. When we design and implement interventions, attention to detail is essential. Whatever approaches we use, skills building seems to be critical for violence against women prevention. So to conclude, what I've shown is that violence against women and girls is preventable through policy initiatives and interventions targeting individuals, couples and communities. Robustly designed and implemented interventions are essential for success, and local tailoring with co-development, that's the big buzzword of the last 5 years in the field, is absolutely vital. And research needs to underpin the development as well as the monitoring and evaluation of interventions. We have an extensive repertoire of interventions that are effective or have been shown to be effective in some settings, and these can be adapted, but adaptation must take into account the local conditions. It takes time and it must be rigorously done. And implementation must be rigorous in all respects for intervention promise to be realised. Thank you very much.